In today's Health Alert, a new study from the CDC is spurring concern about the rise in prediabetes among American teens. Joining us to break this down is Dr. Jessica Shepard. She's the Chief Medical Officer at HERS. Dr. Shepard, thanks for being with us. This study is really alarming. What more do we know about what it says about 30% of American teens being considered pre-diabetic in 2023?
Well, even more, Janae, alarming is that we already see this in adults. So now to kind of put that back in the preteen adolescent stage is very concerning because these are things that can usually be addressed with lifestyle. So we really have to look at what are the causes of this and how do we prevent it? And when we look at that, that's 8.4 million children between the ages of 12 and 17 were labeled pre-diabetic. So that's, again, when blood sugar levels are really elevated and significantly increases your risk of having diabetes later in life. So if later in life for a preteen might be early 20s, 30s, this is concerning because that increases then your risk to heart disease and stroke. So we do know from this study actually that it was more centered on looking at national health and nutrition examinations, which fundamentally is where we start to see some of these rises in blood sugar and also lifestyle. The good thing about this is that we have kind of what you would call maybe a warning or something that we can do on our end to decrease that risk when we think of prediabetes going to diabetes. All boils down to lifestyle, and this is why it's so very important that we do actually focus on what children are intaking with their nutrition, but increasing, again, exercise. And exercise is not necessarily when you think of going to the gym 3 or 4 times a week, but literally less screen time, getting outside and playing, with your peers and your colleagues, enjoying sports and making sure that your kids are actually using their body as a form of movement, which we know decreases that blood sugar.
Yeah, really important to remember that they've got to get their bodies moving and get off of those screens, all of those reminders. Dr. Shepard, there was also another study from the Journal of American Medicine about the health of American children worsening over the past 17 years, with kids more likely to have obesity and chronic diseases and mental health problems like depression. What can you tell us about that?
Yeah, there's a lot that's going to contribute to that as well. Clearly, we went over that with the last study looking at nutrition, but chronic disease is also something that has a broader link when we think of environmental, nutritional, and societal stressors. And that again leads to why we see increased risk of depression and anxiety. Again, with chronic diseases, we do know that 7 out of 10 chronic diseases in the US do have a lifestyle root issue. So again, these are things that we have seen in adults in previous decades, and now we're starting to see that trail back. This is where everyone really needs to look at it from a public health perspective, because not only is it an adult population, we are seeing it now in everybody. So chronic diseases can include, again, things like diabetes, but also diseases that we typically don't see from the chronicity standpoint, starting in childhood and more in adult stages. So again, this is where we need to look at the health care of America and understanding why we're starting to see these shift further back rather into the lifestyle of preteens and adolescents. So really good study. And this again should be a warning sign that America's children are kind of at risk for diseases that we typically did not see in the past.
And to your point about it being a warning and it being eye-opening, it then creates an opportunity to make those changes and make it better. Dr. Shepard, thank you so much for being with us.